For the most part, like alcohol, opioids, by and large, they have a relatively long history. In general, the opioids basically represent a class of drug whose effects are very similar to the parent compound, which is known as opium, or its active ingredient, morphine. Opioids basically reduce pain without inducing unconsciousness. They also produce relaxation and sleep, and they also induce a sense of well being, as well as they're pretty effective in inducing positive, rewarding states, otherwise known as euphoria. Opium has been used medicinally and recreationally for thousands of years, with the earliest uses, once again, probably dating back to prehistoric times. And in fact, there is some evidence which shows that our prehistoric ancestors, in fact, were indeed using opium. Once again, during ancient times, opium, in fact, was used quite extensively as a medicinal agent. So, for an example, the ancient Greeks used opium medicinally for the use of diarrhea, dysentery, as well as other ailments. The Greek physician Hippocrates, for the most part, touted and supported the use of this particular drug for a number of different ailments. In 19th century Europe, especially Britain and the United States, opium was often mixed with alcohol with the addition of flavorings, and essentially was used as an elixir called a laudanum. And laudanum, of course, was used both recreationally as well as medicinally for the treatment of a number of ailments, including aches and pains, diarrhea, cough, headaches, as well as, ironically enough, drug addiction. The drug heroin was invented by the Bayer Company. This is a company that was responsible for the development, for the discovery of aspirin. And what they did in developing or formulating heroin, they actually wanted to produce a version of morphine that would preserve its analgesic effects, but would not have any type of abuse or addictive potential. And what they basically did was they sort of did a similar thing to what they did with morphine or with aspirin, rather. They attached a couple of acetyl groups to the morphine molecule, and in the process made diacetyl morphine, which otherwise became known as heroin. When heroin was first marketed, it was considered a superior form of morphine that lacked the side effects of nausea and vomiting typical for morphine, and had the additional benefit of being administered through alternate routes of administration. It was also originally marketed as non-addictive, but it was soon realized that its abuse was skyrocketing, where it was eventually banned, at least in the USA, by about 1924. Okay, in general, there are many different kinds of opiate drugs. For the most part, in other words, there are many different varieties of them. And by and large, these different varieties can be organized into three general groups. The first group is what is referred to as the natural opioids. And these are basically compounds that are found in the milky extract of the opium poppy. So once again, they're naturally occurring, and they're basically found, once again, within this extract. Examples of these particular substances include morphine and codeine. And there are a few others, but all of these extracts have a similar mechanism of action and behavioral effects, but they tend to vary in potency. Then you have what are called these semi-synthetic opiates, and those are drugs that are produced by the chemical alteration of the natural opioids. So examples, of course, include heroin, hydromorphine, oxycodone, otherwise known as OxyContin, and many others. Typically, these drugs are more potent than the natural opioids by virtue of their enhanced lipid solubility. And then finally, we have what are called the synthetic opioids, and these are compounds that have analgesic effects, but many of them have very little chemical resemblance to the naturally occurring opioids. So once again, examples include fentanyl, meperidine, methadone, as well as many others. Synthetic opioids differ in potency, duration of action, and side effects relative to the natural opioids, with many of them, in fact, being considerably more potent. One word of caution here.